The broadcast is now starting. All attendees are in listen-only mode.
Good evening, everyone. Thank you for joining our webinar tonight. I would like to introduce Samuel Angel. She's a nutritionist with the Northeast Regional Epilepsy Group. She will be presenting treating epilepsy with diet. There will be no question and answer session tonight. However, should you have any questions, please email them directly to me, or I will forward them to Angela, and her response, she will respond to you. Again, I want to thank everybody for coming to our webinar. Thank you very much, Tijan Wujak. Angela, it's all yours.
Thank you very much. Good evening, everyone. My name is Angela Samuels, as Tijan has said, and I am the new dietitian working with the Northeast Regional Epilepsy Center. I had started as a dietitian at Hackensack, and then I ran the ketogenic diet program at New York Presbyterian Columbia campus for 6 years, and now I am back at Hackensack working in the EMU and working outpatient with Northeast Regional Epilepsy Group. Tonight we're going to be talking about diet therapy for epilepsy. The next couple slides are a little scientifically complicated looking, but I'm just going to, this first slide is explaining what our body goes through in the normal fasting state. So normally when a person is eating an American diet and we're fasting, we're using sugar as our main source of energy. So as you can see on the bottom, sugar is maintained, glucose is maintained in our bloodstream as we're eating a normal diet. Sugar that's stored in our liver is converted to glucose and brought into our bloodstream. When we're following a diet for epilepsy, our body's in a state of ketosis. So instead of using glucose or sugar for energy, our body is using fat and oxidizing it as our main fuel source. So as you can see, fatty acids are converted in the liver to ketone bodies, which are then found in our bloodstream. There are 3 types of ketone bodies that are formed, but the one we measure with diet therapy is the beta-hydroxybutyrate. We achieve this by having a diet that's very high in fat, adequate in protein, and very low in carbohydrates. Tonight I'll be addressing 3 diet therapies, first being the classic ketogenic diet, then we'll be addressing a modified Atkins diet, and briefly a low glycemic index therapy for epilepsy. So the goals remain the same for all 3 diet therapies. We want to improve seizure control. We want to promote adequate nutrition so that for children we have adequate weight gain, growth, and development. We would like to reduce or eliminate the amount of anti-epileptic drugs that the patient is taking, and most of all, a better quality of life. So the indications for diet therapy can be any of the following: an unacceptable seizure frequency, medication toxicity, failure of multiple anti-epileptic medications, glucose transport deficiency, the diagnosis of pyruvate dehydrogenase deficiency, and the diet is acceptable for all ages, whereas classically it's thought of as a diet for children. Now we initiate the diet for infants, children, and adults. We do have some contraindications for the diet. For example, we do not like to start the diet during a stress, sepsis, or infectious situation. There are certain inborn errors of metabolism that are contraindicated for the diet. Disorders in which the body is not able to utilize fat as energy, in beta oxidation or fatty acid transport deficiencies. If the family or the caregiver, if we as clinicians feel that they will be non-compliant with diet therapy. Hyperlipidemia, increased blood lipid levels, and medications that will interfere with carbohydrate metabolism, such as a patient being on steroids. This will interfere with the production of ketones for the diet therapy. I apologize for this slide. It's a little blurry. So this is showing, we want to look all the way to the right. The first pie chart is giving us a breakdown of what a standard normal American diet would look like. So approximately 50% of our diet is made of coming from carbohydrate sources, 35% fat, and about 16% is coming from protein. Now we're looking at the modified Atkins diet, which is higher in fat, about 64%. We're lowering the carbohydrates to 6%, and the protein to 30%, and the protein increases to 30%. And the classic ketogenic diet, which is the most restrictive of all the diets, with a 90% fat, 90% of our diet coming from fat, 8% protein, so we make sure that the protein is adequate, and extremely low in carbohydrates, comprising 2% of the diet. So the first diet I'm going to go over is the classic ketogenic diet. So this is the most restrictive of all three of the diets. The main points we should take home is that this diet is only initiated at the hospital. The reason being is that we want to keep a close eye on blood sugar levels and basic lab values to make sure that patients are not becoming too acidotic with the initiation of the diet. The diet is calorie controlled, and all of the food consumed, meals and snacks, are precisely weighed and measured on a gram scale such as the one pictured below. We use a program called the Keto Calculator, which is a web-based program in which the dietitian and the caregiver or parents work together, and we can create menus that are very precise to the gram, and the program calculates the ratio in which has been predetermined by the dietitian. So when I speak about ratios, the ketogenic diet, the classic ketogenic diet is 4-to-1 ratio. And what the ratio means is the 4 is the number of grams of fat to the grams of protein and or carbohydrates. So the higher the ratio in theory, the more ketones you'll be produced, and the higher in fat the diet is. So when you start this diet, the equipment that is usually recommended to bring with you upon admission is a digital scale that measures in grams, small spatulas, mixing bowls, measuring cups and spoons. This is an example of what the Keto Calculator looks like. So after the information about the patient is entered by the dietitian into the program and the ratio is set, you can then add foods and change the amounts to the recommended amounts for the correct ratio. For example, in this meal, we have spinach, eggs, bacon, mayonnaise, and olive oil, which will all have to be measured to these gram amounts to get the correct ratio of 4-to-1. For this meal, this is a 627-calorie meal, and all of the macronutrients, the fat, the protein, and carbohydrates, are compliant with this ratio. At first, the dietitian has access, but can also give access to the caregiver to enter meals themselves to be verified by the dietitian. So it's a team effort. The diet is a huge team effort, in part with the dietitian, the physician, and the caregivers. So the initiation of a classic ketogenic diet. We start with an outpatient family meeting. So whether it's children or adults, they'll meet with the dietitian, myself, and your epileptologist in the office to discuss the diet. Then we'll coordinate an inpatient admission, and you will have to be admitted to the EMU unit and connected to the video EEG monitoring. Usually we like to admit patients on a Sunday or a Monday evening, and we plan for a 5-day admission. If the admission goes smoothly and the diet's tolerated well, the discharge can be planned for earlier than 5 days, but it's really patient dependent. Prior to admission, all of the medications are converted to a sugar-free form. So either tablets usually contain minimal amounts of carbohydrates, but if you're on liquid medications, they would have to be compounded to a sugar-free liquid. And if the diet will be initiated with a tube feeding or supplemental formula, all prior authorizations will be obtained for formulas prior to admission, and families will bring them with them to the hospital. So height, weight, BMI will be calculated, and for children, they'll be plotted on a growth chart as a baseline values, and adults' height, weight, and BMI are also assessed. We'll take a diet and a weight history, and we'll discuss food allergies, food preferences for meal planning, food intolerances that the patient might have. For children, we're giving about 75 to 90% of the calories that are recommended normally for age, and we're giving the protein that meets the DRIs for the protein requirements. For adults, we're calorie restricting a bit from the normal amount of calories that we might give, and again, providing adequate protein. Once we figure out a calorie prescription, then we're dividing the calories into meals and snacks depending on patient preferences, and if it's formula, a feeding schedule. So we're allowing for variety, we're taking food preferences into account again, and allowing for protein adequacy. So we do not fast patients in our hospital admission. So when you are admitted to the hospital, we will start ketogenic diet with probably the first meal in the morning after you're admitted. You'll have blood chemistries are drawn daily to monitor to make sure that the blood is not becoming too acidic. We're doing blood sugar checks to make sure that the glucose is stable. We do expect patients on a ketogenic or modified Atkins diet to have a lower than normal blood sugars, but we're just monitoring to make sure that they're not too low. Urine is checked for ketones with every void while they're in the hospital to monitor for when patients begin to spill ketones in their urine. And all meals will be measured by myself and the family members at the bedside on the scale. If the diet is to be initiated with supplemental formula or tube feeding, we have a couple of options available to us. If a patient has a milk allergy, there's a soy-based formula called Ross Carbohydrate Free. This formula contains protein and fat, but no carbohydrates. So we are adding the amount of carbohydrates, and we're adding additional fat to correct the ratio. So we can add microlipid, which is a safflower oil emulsion, and a sole carb source for carbohydrates. And all these amounts will be prescribed by the dietitian and will have to be weighed and measured on a gram scale just as the food. And we'll give you a recipe for an entire 24 hours worth of formula. If a patient is not allergic to milk, KetoCal is the product that we usually use. It comes already in the correct ratio. So the KetoCal comes 3:1 for smaller infants and children, and 4:1 for larger, older children and adults. It comes in a powder form, which would have to be weighed and measured on a scale, and it also now comes in a liquid form, which can be used as a supplemental to people eating a ketogenic diet, or also used as a tube feeding. And a good point about the KetoCal liquid now is that it contains fiber, which helps with bowel movements on the diet. Diet therapy for epilepsy, because it's so high in fat and low in carbohydrates, it is deficient in vitamins and minerals because of the low amount of fruits and vegetables that are consumed. All patients on diet therapy will go on a multivitamin and a calcium supplement. If a patient is getting a tube feeding, we may adjust the amounts based on the vitamins and minerals that they're getting in their formula. These are just a few forms of sugar-free vitamins and calcium supplements that we're using with diet therapy. So what are the complications of the diet? Some patients may develop renal kidney stones. Usually this is associated with, or can be, this is usually complicated if patients are not drinking enough fluid. That's why we encourage patients to drink large amounts of water and sugar-free fluids while they're on the diet. Hyperlipidemia, so high cholesterol levels, can be a problem on the diet. Sometimes if patients become too acidotic, then we can see problems with vomiting, hypoglycemia, and acidosis. Poor growth, excessive weight gain, sometimes for adults. Vitamin and mineral deficiency, as I've mentioned before, behavioral changes, and the biggest side effect in my experience of the diet is constipation. What do we do when children or adults are sick and they're on a ketogenic or modified Atkins diet? If you're having vomiting and or diarrhea, we encourage sugar-free fluids such as water, Crystal Light, Powerade Zero for electrolytes, clear broth, diet caffeine-free sodas. We want patients to drink fluids every 1 to 2 hours while they're awake and monitor for signs of dehydration, hypoglycemia, lethargy, or rapid breathing. Sometimes IV hydration in the hospital is needed to break the cycle for a sick day. And once you're eating or drinking, you want to start with light, small, frequent meals, and usually half-strength formula diluted with water to help with the vomiting and the diarrhea. If you need emergency care when you're on these diet therapies and you have to go to the emergency room, it's very important that everyone there is aware that the patient should not receive dextrose in IV fluids. All medications that are given should be sugar-free, no Pedialyte for G-tube feedings, and no lactate ringers solution in IV fluids. And you want to alert your primary neurologist, nurse practitioner, and dietitian that the patient is sick and going to the hospital. Outpatient monitoring. After you are discharged from the hospital, after initiation of the diet, there will be phone and email follow-up with myself, the dietitian. Fasting lipid profiles will be done every 3 to 6 months, and we will repeat chemistries, mineral levels in the blood every 3 to 6 months at your visit. We're monitoring weight and growth closely on a growth chart at your visits, and sometimes patients, depending on the situation, may be asked to send weights in more frequently. We may ask you to get weighed either at home or at your local pediatrician. You're sent home monitoring ketones in your urine at least weekly with ketone strips, which just have to be dipped into urine. If a patient is incontinent or wearing a diaper, you can just simply put a cotton ball in their diaper and squeeze over the strip to monitor the urine. There are blood monitoring possibilities for ketones at home with a meter that looks like a blood sugar meter, and it measures ketones. So that depends on the situation and that epileptologist's decision if patients need to monitor blood ketones at home. So some of the controversies surrounding the diet. Some institutions may fluid restrict patients. We found that this concentrates ketones in the urine but also increases your risk for kidney stones. The effects of blood sugars and glycerin, the effect of sugar alcohols and glycerin in medications and food products. These are discouraged as they do affect blood sugar. They are absorbed into your bloodstream and can break ketosis. The duration of the diet is depends on the situation of the patient. I've had patients that have been on the diet for many, many years, and because it's helping, we don't stop the diet. But we do encourage families to stick with the diet for at least a couple of months before we can so we can adequately see if the diet's helping. Another controversy is whether or not this high-fat, high-saturated fat diet is linked to atherosclerosis. We are monitoring blood lipid levels on the diet, and we can change the type of fat to healthier fats if we find blood lipid levels to be rising. Another controversy is fasting before starting the diet. Some institutions will fast patients to jumpstart ketosis, but we start the diet without fasting and still are able to have the patient produce ketones within a reasonable amount of time. And another controversy is outpatient initiation. So in our situation, we are initiating all classic ketogenic diet patients in the hospital for closer monitoring of blood sugars and acidosis, as I've mentioned in the past. The next diet therapy I want to speak about is the modified Atkins diet, which was started at Johns Hopkins Hospital in Baltimore, Maryland. And as you can see, this is the Atkins version of a food guide pyramid, whereas a classic American diet doesn't quite look like this. We're including protein sources on the bottom as the most amount of calories that we're getting. When we're causing the grains to be on the top, where the least amount of food that we're getting is from carbohydrates. The biggest difference with the modified Atkins and the ketogenic are these 3 points: that we initiate modified Atkins in an outpatient setting. You can come to the office and we can have the same evaluation as we would for a classic ketogenic, but we'll start the diet as an outpatient instead of with a hospital admission. It's not calorie controlled, and as you saw from the pie charts earlier, it's lower in fat and higher in protein and carbohydrates than a classic ketogenic diet. How do we get started with a modified Atkins diet? So for children, we'll start on 10 grams of carbs per day, and for adults, we'll start a little higher at 15 to 20 grams of carbs per day. Now, what foods contain carbohydrates? You have your starch foods, which include breads, rice, pasta, all cereals, bagels, pancakes, chips, etc. All fruits have carbohydrates, so we'll say an average piece of fruit, such as a medium apple, a medium banana, contain approximately 30 grams of carbohydrates. So as you can see, based on the number of carbohydrates per day that you'll be allowed on this diet, probably for children, a third of a piece of fruit will be the maximum allowance of carbs for the day. All vegetables have some amount of carbohydrates, but the ones we're concentrating that have the most carbs are your starchy vegetables such as peas, corn, potatoes, and lima beans. These have over twice the amount of carbohydrates than all other non-starchy vegetables, such as lettuce, green beans, broccoli. All dairy products, including milk, yogurt, ice cream, and cheese, have some carbohydrates. Excuse me. Most cheeses have a minimal amount of carbohydrates and can be easily incorporated into the diet. Your sweets, such as cookies, cakes, candies, they all contain high amounts of carbohydrates. And a point we want to stress is that products that are labeled as sugar-free do not mean that they are carbohydrate-free. It just means that they do not have added refined sugar, but they still contain carbohydrates from flour or from, in some cases, dairy products. The miscellaneous category of things that may contain carbohydrates are your condiments, ketchup, barbecue sauces, salad dressings, gum, they all contain carbohydrates. So you have to become a very savvy food label reader if you choose one of these diet therapies. So this slide is meant to explain the net carbs that are used for a modified Atkins diet. So on this diet, we're looking at a food label, and we're looking at the total number of carbs per serving. From this number, we are subtracting the dietary fiber. So for this food, there are 10 grams of total carbohydrates and 5 grams of dietary fiber. We can subtract it, which would give this product a net carb amount of 5 grams. So if you're allowed to have, for example, 15 grams of carbs per day, and you ate 1 cup of this food item, you would only charge yourself 5 grams of carbohydrates. Now, most products that are labeled with net carbs, they are also subtracting sugar alcohols from if they're on the food label. So a few facts about sugar alcohols is that they do not actually contain alcohol. And in the with modified Atkins diet therapy, we are not subtracting sugar alcohols from the total carb amount. Products that are labeled as low carb, such as some low carb pastas, low carb breads, actual Atkins products, Atkins drinks, bars, shakes, meals, some contain very high amounts of sugar alcohols, which are subtracted to give you that net carb amount. But we'll have to modify it and take away the sugar alcohol. Examples of sugar alcohols on a food label, such as mannitol, sorbitol, isomalt, xylitol, all these are sugar alcohols that you'll find on the label. The side effect are GI symptoms, so sugar alcohols can have a gassy, bloating, or laxative effect if eaten in large quantities. So the first step for starting a modified Atkins diet would be to eliminate all high carbohydrate beverages. So this includes juice, soda, and flavored milk. All of these items have well above the carb allotment for the diet therapy. So we want you to substitute these items for things like water, unsweetened iced tea, diet sodas, Crystal Light, seltzer, flavored waters, Diet Snapple, all are appropriate substitutes for the sugary, high-calorie drinks that you may have been drinking before. Once you've eliminated sweetened beverages from your diet, we focus on eliminating sweets and high-carb condiments. So then we want to take away the cookies, cakes, barbecue sauce, ketchup, items like that. We'll also work together. You'll work with myself, the dietitian, to come up with acceptable substitutes for sweets. For example, I'm giving you here, instead of a standard chocolate milk that you may make from a packet or from powder or syrup, we're adding unsweetened cocoa powder mixed with heavy cream that can be diluted to more of a milky consistency and sweetened with a few drops of liquid stevia or some Splenda. Another example would be to make creamsicle pops out of diet soda, like diet root beer or diet orange soda, mixed with heavy cream in a popsicle tray or an ice cube tray for a frozen treat. There are a couple products on the market, one being the Keto Cal powder that I had mentioned before that can be used as a formula. There are also recipes online to include this product to make cakes, muffins, cookies, pancakes, things like that. Another product is Keto Bake, which is a powder that's a 5-to-1 ratio where they have recipes where we can add other carbohydrate or fat sources and bake with it. Same type of baked items, cakes, cookies, muffins. Step 3 would be to eliminate fruits from your diet. So as we mentioned before, the average size fruit can have 30 grams of carbohydrates. So small portions of fruit on certain days may be your choice to use that as your carb allotment, such as a half a cup of blueberries for 10 grams, or a third of a very large banana, a third of a large banana for 10 grams of carbohydrates. We want you to include some fruits and vegetables as your carb sources to help with the side effect that is constipation. Step 4 would be to increase your protein sources. So we want to make sure that you're increasing protein, such as foods such as meats, poultry, seafood, and eggs. One of these items should be eaten with every meal to keep yourself satisfied and to ensure adequate protein intake. Step 5 would be to decrease the portion sizes of starchy foods that you're eating. So this is often one of the most difficult challenges for people because carbohydrates comprise such a large part of our diet. So we suggest instead of making a sandwich with 2 slices of bread, you start with just the bottom and double the portions of meat to increase your protein, and eventually we'll eliminate all starchy foods from 1 meal per day and work from there. Step 6 is adding fat to your diet. So this is essential, as with these diet therapies, your body is using fat as its main energy source. So we want to make sure that we're adding oil, butter, margarine, heavy cream, and mayonnaise to meals. You can start using heavy cream as a substitute for milk. We dilute it to a more milky consistency. We can add heavy cream to scrambled eggs, fry meats and vegetables with oil, melt butter over your meat or poultry or fish as a sauce, making food items such as chicken salad, tuna salad, or using mayo as a dip, making cream sauces for vegetables or meats with heavy cream and cheese. This is a very important step in the diet and often a hard one because people are not used to consuming so much fat during the day. One note on MCT, which is short for medium chain triglycerides. This is a type of fat that is easily absorbed by the body, and we call it a ketogenic fat, meaning that it's absorbed so quickly and can help to produce higher levels of ketones. It's derived from coconut and palm oil, and we encourage patients to use MCT but incorporate it slowly into your diet because it can cause a laxative effect if incorporated too quickly. But this is sometimes helpful as the diet is, as we've mentioned many times, constipating. The MCT can help alleviate that effect. Coconut oil, which is at room temperature is liquid and solid when refrigerated, can be used similar to butter. It can be mixed into vegetables, spread onto low-carb bread or crackers. There are recipes to add cocoa powder and a drop of peppermint extract and freeze blobs of coconut oil as MCT candies. So there's a lot of options to incorporate coconut oil and MCT into your diet. So how do we put all these steps for the modified Atkins diet together? Contact your dietitian regularly to monitor the progress of the above steps. If you get stuck on one step, we work together to overcome the obstacle until we get to be able to move on to the next step. Once you've reached your goal for amount of carbohydrates, we'll begin to check urine ketones at home with the urine dipsticks. We'll use how we follow up with your labs. The follow-up is similar to that of a ketogenic diet. We'll be checking fasting lipid panels. We'll be checking chemistries, vitamin and mineral levels every 3 to 6 months. All of your medications, also on a modified Atkins, will be converted to sugar-free. You will still take a sugar-free vitamin and mineral supplement, and eventually we'll be able to increase the carb amount by 5 grams a month to a maximum of 20 to 30 grams of carbs, depending on the size of the patient, as long as we're continue to see positive effects in spilled urine ketones. The last diet therapy I want to touch upon is a low glycemic index treatment. So the goal for this therapy is the same as ketogenic and modified Atkins. We want to reduce the seizures, decrease or eliminate anti-epileptic medications, and improve quality of life for the patient. This is the most liberal of all the diet therapies. We're allowing 40 to 60 grams of carbohydrates per day. We would like them to be spread evenly throughout the day, divided between meals and snacks, and every time a carb is consumed, it should be eaten with a protein and or a fat for balance. This is designed to prevent the high and low fluctuations in blood sugar levels. Because when you eat a carbohydrate with protein and fat, the sugar is absorbed more slowly into your bloodstream, preventing the fluctuations. So the diet distribution is a little different than the other diet therapies. The carbohydrate is about 10% of your daily calories, protein from 20 to 30% of your calories, and fat 60 to 70%. So we still want you to add fats to your diet. This, again, is another therapy that's not calorie controlled. The food is not weighed and measured, but we are choosing low glycemic index foods. For instance, the foods that are, we have what's called a low glycemic index chart, where foods are scored based on their effective blood sugar compared to 100 grams of sugar. So for instance, foods that are higher in fiber, higher in fat, or combination foods have a lower glycemic index than, say, ice cream or dates, which are dried fruit, very concentrated in sugars. So we're choosing foods that are low on the glycemic index scale, 55 or below. So you'll have a glycemic index chart to choose which fruits, vegetables, and starches that you plan on eating. A few resources for the diet. One is the Charlie Foundation website, which has a lot of information for parents and for caregivers or patients if you're an adult. They have a very comprehensive list, which I use and give out to patients, of carb-free products or low-carb products that we might not always be thinking about, such as over-the-counter medications, shampoos, lotions, suntan lotions, things like that. Matthew's Friends is another website that's UK-based with the same kind of support information. I highly recommend the Keto Cookbook if you're going to go the route of the classic ketogenic diet. It was developed by a dietitian and a mother out of Children's National in Washington, D.C. And it has breakfast, lunch, dinner, snack ideas, all measured to a 4-to-1 ratio. And if your ratio is different from the book or calorie level, they could be adjusted by the dietitian, by myself, to accommodate your meal plan. As Tijan said, any questions regarding the diet can be emailed directly to him, or my email address is on the screen, acsamuels23@gmail.com. I welcome any questions regarding the diet, and I'm seeing patients in the office with Dr. Segal, the pediatric epileptologist, and Dr. Fioli for patients that are interested in starting the classic ketogenic diet, the modified Atkins diet, or the low glycemic index therapy. Thank you all for listening to this webinar this evening, and I hope to hear from some of you soon.